I'm Jay Ganapathy. I'm a pediatric consultant at Hillingdon Hospital. There are about 13,000 children and young people with type 1 diabetes in schools in the United Kingdom.
I'm Phoebe. I'm one of the paediatric diabetes nurses. We have about 100 children and young people with diabetes under the age of 16 in our care.
My name is Raymond. I'm 12 years old and I was diagnosed with type 1 diabetes when I was 11. When I found out I had diabetes, I felt upset. I was worried about would I have to miss some of the sports that I do. I did have to miss out for a little bit because I didn't feel like I wanted to go to it. I found out that it was not a big deal and I can do the activities that I still enjoy.
With the increase of diabetes in children of school age, a child with diabetes will miss up to 5 times a year of school to attend their clinic appointments.
We noticed that it is a lot of disruption of the activity.
Each appointment could take up to half a day with the added pressures of finding parking, taking time off work to attend these appointments. We realised the impact these added pressures were having on each child that were missing school. So we came up with the innovative idea of bringing clinic to the school.
When we first thought about going to school clinic, we thought there might be quite a lot of resistance from young people, that they wouldn't want to see us in their environment or at school. But actually we found quite the opposite. Schools are located close to people's homes, parents are used to going there, and they're more relaxed in school and they find it easier to talk. And the big issue for us is that they attend, so we get much better attendance rates during school clinic than what we did when they were expected to come to the hospital.
We had a Twinkle-enabled laptop, which means we had access to all the IT systems in hospital, and actually the rest is all portable in the back of my car. It's very easy to do.
We visit a school about 4 times a year. The team includes a paediatric diabetes consultant, specialist nurse, and a paediatric diabetes specialist dietitian. We bring all the necessary equipment for the clinic, asking only for the school to kindly provide us with a room and permission for the child to attend their appointment along with their parent.
So we agreed to the hospital bringing the clinic to the school because it made sense to work closely in partnership. And at that time we had a high number. We had 10 diabetic students, so obviously we're very keen to work with the hospital to support those students and just to make that part of their daily routine easier and better for them. The school and the school routine is what they're used to, it's what they do. They're surrounded by their friends and their support within school. So to us it made absolute sense to do that at that time.
I'd have to arrange to pick Raymond up at least 2 hours before his appointment time, and it's disruption to his school day and his lessons and his learning. He might have actually missed that bit of lesson to do with the homework, so he wouldn't even know what the homework was about.
It saves a lot of time, so then I can be more in school. If I had to go into a hospital, then I would feel uncomfortable because there's lots of people around me and who I don't know. They might ask questions. And it would make me feel different to other children because I have to leave the school premises and then come back and then people will be like, where did you go?
It was strange coming, first of all, to the school for an appointment. I did find that very strange, but it's so much better.
Any changes you've made?
I've made changes to his tea ratio because I found that we were doing 8 for tea, and I found that he kept, he was either really dropping or really going the other way. So I had to keep either waking him up during the night to correct him or waking him up during the night to get him out of hypo. So we're using 12 now.
There can be 2 things that cause that. So it could be the activity you did during the day is having an impact, which means you might find actually on the days you've done more activity, you might need a different ratio with your evening meal. And also it can be due to the amount of fat that you have in the meal. So if you're having maybe something like a pizza, you might find actually you need a little bit more insulin to have with that.
Which means he's also part of understanding and making that decisions, and it's really important going forward.
I mean, when we were first changing it, we had his phone out, our calculator out, and my phone out for the calculators, and we did 3 different ratio so we did 8, 10 and 12, and so we were like comparing how much difference there was as well.
Huge difference, because it's all those changes every week, small, right or wrong, trying. It's really important, because this is the effect of your joint effort. Can you see? This is his HbA1c chart. Yeah, so every time he comes, we do that finger prick, looks at his 3 monthly average. We need it to be around 48 or better. And look at him, he's made steady progress, and he's as close to the 48 as he can. So it's 50 today, which is excellent. What we like to start doing going forward is empowering him to talk about his diabetes in clinic. And what we'd offer you, if that's okay with both of you, is from the next clinic, you come as usual, but we see him alone for the first 10 minutes. We'll have fun, don't worry. Yeah, and then we can call Mum in to talk about what we discussed and what you would like as talking points, okay? And gradually with time, we're hoping that he'd take control of all the questions, how to direct his management, so that by the time he's 16, he's pretty much, the guy in control. You got any questions on that? Does that worry you? Okay. So the other thing about school clinic is, again, this is to do with you growing up, is they'd sometimes prefer their friends coming to clinic. So our last few patients came with their friends to clinic. They find that it's a good support structure they have in school. Life gets busier, lunchtime gets chaotic, and sometimes having a friend that reminds you about, let's slow down for Raymond, let him do his thing, and then we can go together. It helps. You don't want to be left out, isn't it? But you want to think about that. So over the course of next year, think about if you want to bring a friend, ask them to speak to their mum and dad to get permission to come to sit in your clinic. And they could sit in for 5-10 minutes. Would you find that useful? Okay, that's great. So I think just to summarize, this is great. Yeah, this is really amazing. I think it's good joint working between you two. Keep that going. Can you see that, Raymond? So most of them are in target. You have a few hypos, but he's keeping himself safe. I think that's really important. I've made notes on things you're doing well. Firstly is maintaining a diary. Second thing is weekly mums clinic. Yes. And the third thing is the exercise we talked about. Okay. So those are 3 objectives. Yeah. So well done. So you happy with the school clinic arrangement? Is it okay with you? What class did you miss today?
Science.
Science. Okay. And you're happy with the arrangements? Yeah. Good. Excellent.
At the end of clinic, I will update the person responsible for welfare within the school of any changes. There is also an opportunity to bring up any issues and address any specific training needs.
There have been minor adjustments that we've had to make for Raymond to support him. Obviously allowing him out of lessons at particular times and being sensitive to that, and just being aware that he may be missing parts of his learning, and that's actually been kept to a minimum.
Teachers could know what time I need to check and then ask me, do you want to go outside and do your bloods or stay in here?
This is so much better because he might say miss 40 minutes of a lesson, but that to me is a lot different to missing 2 hours or even more than 2 hours.
The hospital made me feel better and more confident in what I do. It helps me feel more supported by my friends.
Everything we do as a school is about collaboration, and actually what we strongly believe that for all our students, they will be more successful if they support each other and also if they receive support from each other as well as members of staff.
Quickly after starting the school clinics, we ran a survey just to make sure we were doing the right thing, and we were pleased to see that the feedback was unanimous, that they really wanted school clinic. And in fact, the success of our school clinics and the publicity it has gained has meant that neighbouring hospitals have emulated the same service. Ealing Hospital, which is our neighbouring hospital, I'm pleased to say, have been doing a regular school clinic for the past few months, and the feedback equally is as good as ours.
My experience of working with the hospital team has been extremely positive. It's been a really strong relationship over the years, and I know it will continue to be in the future.
My name's Matt, I'm 18 years old. I was diagnosed with type 1 diabetes at 11 years old.
What do you see as the advantages and disadvantages of either? So what do you think worked for you?
What really worked for me at school was the fact that it was so convenient, especially during the period of my GCSEs, where revision sessions are imperative and really important, and you don't want to miss them. So having a school clinic in a classroom, I just spend half an hour, 40 minutes with you guys, and get height, weight checked. Everything is normal as per the hospital appointment, and I'd save time.
What kind of feelings and thoughts, and how did that play out for you?
I felt initially quite embarrassed. I felt that my friends, my closer friends, accepted it. They were absolutely fine about you guys coming along, and that made me feel a lot more confident. It worked really well, and it didn't bother me. So yeah, I was a little bit cautious at the start, but as it went along, I think it was absolutely fine.
Excellent. What kind of setting would you prefer? Would you prefer the hospital environment again for that, or would you prefer university-style clinic?
I'd definitely go straight for the school model. It is a lot more convenient, and a future hospital appointment, which I've already made in February, I'm going to miss 2 or 3 lectures. And again, it's quite inconvenient to get to. It's quite a long bus ride away, and ultimately having it in the university environment means that it's very convenient. I save more time by going to my lectures. So yeah, it's a big tick if we did it in the university environment.
Good. That's so very interesting to hear. To summarise, the main advantages of doing clinic was 1, the proximity for parents and young people. 2, attendance is near maximum. They feel at ease at their school environment. There was a demonstrable increase in school attendance, which equates to better performance in school in most instances. Parent satisfaction was better, and we also used that opportunity to foster training and working together with schools managing their type 1 diabetes. The easiest bit to take away from this is easily replicable within your service.